A possible breakthrough in treating addiction, brain surgery. I know it may sound extreme, but it could be the future of how we combat the opioid epidemic, which takes more than 100 American lives every day. Diane Macedo has that important story for us. Good morning, Diane.
Robin, good morning. So this procedure has actually been around for decades, but it's never been used like this. Doctors are essentially using pacemakers in the brain to try to curb addiction, and we got a chance to talk to their very first patient. This morning, a procedure used to treat disorders like Parkinson's and epilepsy is creating hope for those who suffer from addiction. Patient Jim Hudson suffered from an essential tremor for 30 years, but after undergoing deep brain stimulation, or DBS, he's made a remarkable recovery. Now the procedure is being tested to help curb cravings and anxiety.
The only thing that you want to do is get high because that's all you know how to do.
Jared Buckhalter has been addicted to opioids for over 18 years. He's now the first U.S. patient to have DBS treatment aimed at addiction.
I tried every avenue of recovery that you could possibly find.
Desperate, he turned to the Rockefeller Neuroscience Institute at West Virginia University.
When the addiction gets so severe, it becomes a brain condition, and there's a parts of the brain that is driving you to have increased cravings, and it's a drive for you to seek drugs.
Since Jared's repeated stints in rehab and therapy failed, Dr. Ali Rezai admitted him to an initial trial for deep brain stimulation.
It was very similar to a heart pacemaker, except the wires go into the brain. They're implanted in the part of the brain causing tremors to stop the tremors of Parkinson's disease, or in a different part of the brain to stop the seizures from epilepsy. In this case, we're implanting them in a part of the brain involved in addiction.
For Jared, the results have been promising. He's now sober almost a year.
I was as bad as they can get, and if it can help me, then it can help anybody.
Now, it's important to note this treatment is still in early trial stages, and it's really only intended for people who've already tried other treatments. But for Jared, he's been addicted to opioids since getting shoulder surgery in high school. So for him, these results, pretty remarkable, Robin.
Yeah, and very, very promising. Diane, thank you. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.